What is a herniated disc? One common diagnosis when a patient has low back problems or spinal problems or neck problems is they were diagnosed with a herniated disc. And this typically occurs after an MRI evaluation or imaging of the spine. And when we understand the basic anatomy of the spine, we know the spine is definitely broken down into three main sections. The cervical spine, which is in the neck, the thoracic spine, which is in the middle or the upper back, and then the lumbar spine, which is the lower back. And each section of the spine is made up of vertebrae or bones, and these bones are stacked up upon each other with something in between every set of vertebrae, and that's something called an intervertebral disc or a disc. Intervertebral discs are spinal structures that with a tough, durable outer layer, which is called an annulus. And inside of each disc, we have a gel-like material. In the very center, we have something called your nucleus pulposus, which is a very fibrous material. And these discs are made up of layers of collagen and proteins, and they have water in there, and they're designed to actually support the spine into a proper position. The discs play lots of roles, but more specifically, they help the spine be stable, but also facilitate spinal flexibility. The most common reason why patients experience the loss of flexibility within the spine or range of motion is because they have problems or issues with their discs. The discs help provide normal spinal structures, which is the normal curvatures from the side of the spine and proper alignment from the front. Discs also provide normal cushioning between the vertebra, so the spine doesn't deteriorate or degenerate with movement and wear. And they act as a shock absorber. I mean, they specifically help disperse the mechanical forces of gravity and forces throughout the spine evenly, so they can actually help prevent the spine from being injured or deteriorated or shifting out of alignment due to compressive forces. However, discs can become damaged, and the way they become damaged is with abnormal alignment or injury can cause the spine to shift out of alignment and cause these discs to damage or become herniated. And when these things become damaged, they have to go through treatment options. There are many different treatment options when it comes to dealing with herniated discs, and sometimes surgically and non-surgically. Disc repair by itself is a very difficult issue because after we have stopped growing, the discs no longer have blood supply, they no longer have vascular supply, and the way discs actually get nutrients is from their surrounding areas through a process called osmosis and inhibition, meaning movement of the disc itself is what allows the spine or the disc to absorb nutrients in and out. Think of it like a sponge. They don't actually have blood supply, so therefore discs don't heal very well. So therefore to help to treat a damaged disc focuses on improving motion and mobility and circulation in around those areas, first of all, to prevent further damage, but number two is to restore as much function as possible to the area that's been damaged. So what is a herniated disc? A herniated disc is when the inner material, the gel or the nucleus pulposus, tears through the outer layer of the annulus and is now herniated through either a tear or a cut in that disc material. And that disc, because when the material starts to come out, it actually changes its shape, and since it loses some of its gel, it becomes something we call desiccated. Desiccated is when discs become thin and become less hydrated. This disc material now can invade the space within the spinal nerves and canal. When it affects the spinal nerves and canal, it can start affecting neurological issues causing radiating pain or pain in that area, and it also can start affecting motion of that vertebra segment, which can lead to a loss of motion in the general area of the spine. This nerve compression or irritation, though, tends to be the number one thing that it tends to cause in terms of pain or problems or symptoms. It tends to be compression or irritation to the nerves or discs, nerves or tissues or muscles in that area. The most common treatment option for herniated disc, unfortunately, is just medications and injections. Now that you understand that a herniated disc is when the spine shifts and the disc bulges out and it herniates through the annulus, you can see that taking medications or having injections could help you with the symptoms, but the disc material is still sitting in the same place. So therefore, they're just kind of helping deal with the symptoms and not dealing with the actual cause. Surgically, they do something called discectomies, where they cut and they remove the entire disc or a part of the disc, whatever's going out, they remove part of the disc material and they cut it out. However, when they cut that gel or material that's that's gone out, it can make the disc overall weaker, which can lead it more prone to more further herniations and bulging. Laminectomies is where they actually cut the removal of the back of the vertebra, and that's normally responded with spinal fusion. They go in there and they fuse the spine together with rods and screws. Now, unfortunately, spinal fusion may eliminate the disc herniation, but now the bones that were moving no longer can move because now they're fused. It can refer problems up, below, and above that fusion, which can lead to further herniations and problems above, which can lead to more surgeries. So therefore, if you have one surgery, you're more prone to have multiple surgeries. So therefore, we like to focus more on non-surgical treatment. And non-surgical treatment is helping to restore normal alignment and motion into that area so the disc can receive its proper nutrients and start to help regenerate. And hopefully the disc can kind of sequester back into the material, sequester back into the disc, and we can increase the height by the disc absorbing more surrounding nutrients through motion and mobility. This type of treatment typically involves physical therapy, exercises, chiropractic care, different types of traction, rehabilitation, different types of exercises and therapy can be performed to help realign the spine, to help not only prevent the disc from further herniating, but help decrease the chance of it actually continuing to herniate, but help unherniate some of that material back into the normal alignment. We do know that discs have the ability to sequester back in if they're properly placed in the right position. However, if the forces on that disc aren't changed, those discs will never go through a regenerative phase, and unfortunately, all we can expect is further herniation and degeneration to occur. So treatment driven by correcting the underlying cause is what we really want to focus on, because if you're just treating the symptoms of the herniated disc is still sitting there, and it's also continuing to lead to further and further problems. At Scoliosis Reduction Center, we offer completely non-invasive and effective treatments combining multiple disciplines, different types of therapies, exercise, physical therapy, chiropractic care, neuromuscular education, vibration, and tractions to give the very best results for patients that actually suffer from herniated discs, to get the very best results possible for each and every individual case. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.